Hesitancy is super common in colorectal cancer screening specifically, but probably in all cancer screening. And I think one of the most helpful things to explain to patients is, first of all, how common colorectal cancer is. So for people to know that in non-smokers, colorectal cancer is the #1 cause of cancer death, realizing that this is really the cancer that we should be most concerned about. And then also realizing that by doing cancer screening, we can actually prevent colorectal cancer from happening in the first place. And if we do identify colorectal cancer, we can identify it at earlier stages when it is much more treatable, and that people can actually be cured from having colorectal cancer by actually just finding it early. So those kind of things are, I think, extremely important in those patients who are hesitant. I think a lot of people have the feeling like, if it's there, I don't even want to know. I don't think that's really a good or healthy way of looking at it, since this is one where finding out about it doesn't mean you have a death sentence. It can actually mean the difference between being able to lead a life without cancer or, waiting and then having something that's going to be a cancer killer, which it can definitely be. So identifying things early makes a huge difference, and patients need to understand that so that they can make an educated choice. There's a lot of fear around colorectal cancer screening, but really finding things earlier makes all the difference. So that means that sometimes people don't have to even undergo a surgery, don't have to undergo cancer chemotherapy, because it's so easy to treat when it's found early on.
As a family medicine doctor who does endoscopy, I'm always paying attention to preventative health care. And I think primarily it is primary care physicians who are making these referrals for screening tests. It's important to pay attention to your patient's personal history, whether they've had endoscopy in the past, whether they've had a history of polyps, and what type and how many. It's important to know what their family history is. Do they have a family history of colon cancer? Do they have a family history of other cancers that might be related to some kind of genetic mutation that we could look into? It's important to know about other risk factors like smoking, some dietary risk factors for all GI cancers, like do they eat a lot of smoked meat products? There are some connections with lots of processed foods in colon cancer. And so those are important things to screen for.